I am sorry I'm a little bit late fighting with my router again. So it's 9:35, so I'm 5 minutes late. Nice crisp fall day in Boonville, Missouri. So hopefully my router won't kick me off. I've had a little bit of trouble getting on this morning. And then I got a phone call at 9:28. So um, that I actually had to take. So we are talking about vitamin C this morning, and there's a reason. So vitamin C. Good morning, Linda and Eileen. Vitamin C. This is from October 13th. In high doses, is now being used and has a randomized study, and we'll talk about that in a little bit, for use in COVID-19 treatment. Hey, Wendy. So I told you last Friday about my Uncle Elmer. He had gone to the hospital, Harry S. Truman VA Hospital in Columbia, Missouri. He's 96, was 96. He wound up passing away from COVID-19 last Saturday. And my cousin had asked me, had been Facebook messaging me about her dad, etc. And I told her, I said, well, see if his doctors at the VA would give him high dose vitamin C intravenously, worth a shot. I mean, he was in the ICU on BiPAP, and he had a feeding tube, nasogastric tube in to feed him. He had just gotten very weak and had difficulty breathing. He was a World War II veteran, U.S. Navy. He witnessed the Japanese surrender on the USS Missouri on that day 75 years ago. He was scheduled to go to Hawaii for a 75th anniversary reunion, I guess, for any of those guys that were still alive, and they were all in their 90s. That got canceled from COVID-19, and then he passed away 6 weeks after he was supposed to be in Hawaii for that reunion. So this study that I'm going to talk about is being used in COVID-19, not in this country. Of course, it's in China. But it's been published, preliminary results, with a reduction in 2/3 of death from COVID-19 and using high-dose vitamin C. So I thought it was worth reviewing the health benefits of vitamin C. Most people don't even think about it. And then I'm going to share with you a personal story about a guy that has been using voluminous amounts of vitamin C for about 40 years. He's 78 years old. So it's an interesting little story. So first thing we'll do is kind of review vitamin C. So vitamin C is an essential vitamin, which means you don't make it, you have to intake it. And most people say, well, you can get enough vitamin C from your diet, which may or may not be true. It's true to help you continue to be alive, for instance. So it has a lot of roles, and it's linked to a lot of impressive health benefits. So if you think about vitamin C deficiency, which is the issue that appears to be occurring in people who actually pass away from COVID-19, that is known as scurvy. So scurvy killed 2 million sailors around the world from 1500 to 1800. And a guy named James Lind, Lind, worked out what was happening in 1747. So he worked out the cure for scurvy, and it was vitamin C in limes. Okay, took 50 years for the navies of the world to pay attention to that and to take it seriously. So dramatic was the effects of limes and the life-saving effects in sailors who were suffering from scurvy that sailors got to be known as limeys because they would eat limes while they were on. It took 3 months to cross the Atlantic back during those kind of cool sailor ship days back in the 1700s. Okay, so here's the deal. The recommended daily intake for vitamin C is only 75 milligrams for women and 90 milligrams for men. Most of the time it's found in fruits and vegetables. Everybody knows about oranges and vitamin C. Strawberries, kiwi fruit, broccoli, spinach, peppers, bell peppers. So a lot of people do take supplements. I'm one of them. And they will take about 500 milligrams a day, which seems to be pretty well tolerated. Okay, so what's the deal? Why should you take vitamin C supplements? And then the personal story I'm going to share with you is going to argue that you should take way more vitamin C than 500 milligrams a day. So it's an antioxidant. It strengthens your body's natural defense to chronic disease. So vitamin C may reduce your risk of chronic disease, which is what, as a health coach, I'm trying to do. I want you to be able to not have to go to the doctor, not have to take pharmaceutical medications, right? So antioxidants boost your immune system, and they protect cells from harmful molecules called free radicals. We've talked about it, I don't know how many times, oxygen reactive species. And when free radicals and reactive oxygen species accumulate, that causes oxidative stress, which is linked to chronic disease. So we talked about that with mitochondrial dysfunction. The mitochondria is what directs the cell for apoptosis, direct the cell to say, well, there's so much damage that the cell needs to commit suicide. That's part of the aging process that gets kind of out of control. And so consuming vitamin C by, and this is peer reviewed, so I'm looking at studies on this, can increase your blood antioxidant levels by 30% just by itself, so vitamin C. And they're talking about the 500 milligram dose, okay? Vitamin C may help manage blood pressure. It's not as dramatic as some of the other antioxidants that we've talked about, but there are studies that show that vitamin C can reduce blood pressure, systolic and diastolic blood pressure. So about 30% of Americans have hypertension, putting you at risk of heart disease, which is the leading cause of death worldwide, right? So vitamin C may lower blood pressure in people that have high blood pressure and people that don't have high blood pressure. Okay, so looking at 29 human studies, vitamin C supplementation reduced systolic blood pressure, the upper number, by about 4 millimeters of mercury, and diastolic blood pressure by 1.5 on average in healthy adults. That's not a huge amount, but it's there. In adults with high blood pressure, from looking at those studies, systolic blood pressure from vitamin C supplementation reduced 5 millimeters of mercury pressure, and the diastolic, the lower number, by 1.7 millimeters of mercury. So by itself probably will not reverse hypertension, but it does have an effect. Vitamin C may lower your risk of heart disease because of the hypertension, part of the hypertension thing, but it also seems to reduce the risk factors of high triglyceride and low density lipoprotein. Again, in this article they call that cholesterol, and it's not. It's a taxi for cholesterol. It's a lipoprotein. Okay. Also seems to help raise high density lipoprotein, which is considered the good taxi for cholesterol. So 9 studies on 293,172 participants found that after 10 years of vitamin C at 700 milligrams a day had a 25% lower risk of heart disease than those who did not take a vitamin C supplement. So presumably they were getting their 75 and 90 milligrams of vitamin C from their diet, and then taking no supplement. If those people took supplements of 700 milligrams, so it's a little higher than what's usually recommended, 25% reduction in heart disease. Okay. Okay. Another 13 studies looked at the effect of taking 500 milligrams of vitamin C daily. And that was found to reduce LDL levels by approximately 8 milligrams per deciliter and blood triglycerides by 20. So, based on those studies, this article is saying 500 milligrams of vitamin C daily may reduce the risk of heart disease. The 29 studies was based on 700 milligrams daily. Okay, vitamin C can reduce blood uric acid levels and help prevent gout attacks. So that's about 4% of Americans that have gout. A friend of mine has reduced her gout issues with vitamin C and CBD oil. That seems to help her. So gout happens when there's more uric acid in the blood. It's a waste product that's produced by the body, and it may crystallize and deposit in joints, usually the big toe. Okay? So vitamin C, in a study of 1,387 men, significantly lower blood levels of uric acid on those who were consuming vitamin C supplements. Okay. Okay. Another study of 47,000 healthy men over 20 years found that those that took vitamin C supplements had a 44% lower gout risk. Okay. And even 13 studies found that just supplementing for 30 days significantly reduced uric acid levels in the blood compared with a placebo. Okay. Okay, now this one I've used. Helps prevent iron deficiency. So pregnant women tend to be iron deficient. Women in general tend to be iron deficient. And obstetricians tell them to take iron sulfate, 325 milligrams once or twice a day. The commonest complaint is constipation. And I was taught by a family medicine doctor in Osceola, Missouri in the 1980s. Two things. He said, ask women if they like to chew ice, and if they do, measure their iron levels. They're always iron deficient and usually anemic. So chewing ice was the thing that he picked up. And he said, if you will give them 500 milligrams of vitamin C twice a day with their iron, you will improve their iron absorption up to 90%. So he said taking an iron supplement, usually about 10% absorption, the rest of it stays in the intestine and causes constipation. And he said if you add vitamin C, it increases the iron absorption by 90% or to 90%, and they don't get constipated. Well, sure enough, they have studied that. And there was even a company that came out with a vitamin C iron supplement specifically for pregnant women that didn't make it market share wise, because it was like a $30 a month thing, so $1 a day, which then, and we're going back 20 years. And I told the guy, I said, if you made that like 10 or 15, people would buy it all day long. It wasn't covered by insurance because it's over the counter. And I said, people can buy iron sulfate and vitamin C over the counter for about $6 a month back then. They, I think, overpriced their product and didn't make it. Okay, the immune system function of vitamin C is one of the main reasons people take vitamin C supplements. It's involved in a lot of the parts of the immune system. It encourages white blood cells such as lymphocytes and phagocytes, which help protect you against infection. It also helps those white blood cells function more effectively and protects them from damage by free radicals. Okay? And then it's also involved in the skin's defense system. So it increases the ability of the skin to fight off things trying to get through the skin barrier, which is one of the reasons, the skin is for protection. Vitamin C has also been shown to shorten wound healing time. Vitamin C also helps with memory and thinking as you get older. So dementia is one of those things that people worry about. About 35 million people worldwide have difficulty with early on, well, I'm not going to say early onset, but some form of dementia. Okay? And that seems to be from oxidative stress and inflammation near the brain, the spine, and the nerves. Okay? And that increases dementia. It's not all Alzheimer's, but that's part of it. So vitamin C is a strong antioxidant, and low levels of that vitamin have been linked to the impairment of thinking and memory. So people with dementia seem to have lower blood levels of vitamin C. It's an easy blood test to do. I can't remember the last time I saw a vitamin C blood test from somebody who sent me their labs that were ordered by a physician. Okay? So, what's unproven, and this goes back to Linus Pauling 50 years ago when he said higher dose vitamin C would protect you and prevent the common cold. That appears not to be true except in one specific subset of people. So the unproven claims um, is that vitamin C prevents the common cold. It appears not to. What it does do is reduce the severity and reduce the recovery time of people that get the common cold, which is a coronavirus. Okay? It's also been touted to be an anti-cancer vitamin. That's never been proven. So all the studies, it appears not to reduce the risk of development of any certain kinds of cancers. Everybody thinks vitamin C helps with your eyes and prevent eye disease and age-related macular degeneration. That appears not to be true. And then there's some reports that it helps with lead toxicity. So that's basically the health benefits. So that's at a 500 milligram dose. Now we're going to talk about October 13th, 2020, where the first randomized placebo-controlled trial that was designed to test high-dose intravenous vitamin C for treatment of COVID-19 has reduced mortality in the most critically ill patients by 2/3. Okay, so this is in Wuhan, China. Okay, so going back to February, it started in February, they gave every other critically ill COVID-19 patient on ventilators either 12,000 milligrams of vitamin C twice daily or sterile water in their IV drips. So the patients nor the doctors knew who was getting vitamin C and who was just getting sterile water. So it was double-blinded, gold standard of research design. Okay? So vitamin C basically halved the number of deaths. So those on vitamin C were 60% more likely to survive. So that's 2/3 improvement in survival. Okay? So the key measure of severity and symptoms in this disease is called the severity of symptoms, or the SOFA oxygenation index. Okay? Those with an index greater than 3 were the most critically ill. And of those the most critically ill, 18% of the vitamin C group died compared to 50% in the placebo group. So 2/3 less deaths in the most critically ill people. Okay? So of those most critically ill, statistically, if they were given vitamin C, they were 80% less likely to die. Okay, the result, which was backed up with reduction in inflammatory markers in their blood, was statistically significant beyond a shadow of a doubt. That level of benefit is greater than the benefit seen in the randomized controlled trial on dexamethasone, which has been in the news in the last couple of weeks. That's an anti-inflammatory steroid that was considered the only proven treatment for COVID-19. Okay? In this particular trial, 23% of patients on that steroid died compared to 26% on placebo. So there were over 6,000 people in this trial. So it wasn't like, well, we tried this on 10 people and this is what happened. This is 6,000 people. So now there appears to be another proven treatment, and it's vitamin C. Okay? So 50 million 1-gram doses of vitamin C was shipped to Wuhan and given to hospitalized patients and also hospital workers based on what was going on with this. And so new admissions to the ICU plummeted by doing that. Let me see, I read that. So they're especially so this is kind of especially important in case reports in the American ICUs using 12,000 milligrams of vitamin C showing almost no deaths in anyone with a pre-existing end-stage disease already. Okay, and also over the age of 85. And then there's a British ICU using 2,000 milligrams of vitamin C, reporting the lowest mortality of all intensive care units in the United Kingdom, cutting deaths by a quarter. Okay, so the best results on COVID-19 are being reported in intensive care units using vitamin C, steroids, and anticoagulant drugs combined, and that's been the standard protocol in China since April. So, is China telling the truth? Well, they're publishing that. So China's mortality rate from COVID-19 is 3 persons per million compared to the United Kingdom's 624 persons per million. Okay, and that's according to data worldwide. And then there's data coming in from ICUs that are testing blood vitamin C levels, and the vast majority of critically ill patients are vitamin C deficient, many with undetectable levels of vitamin C that would be considered scurvy. Okay, so apparently this disease actually creates a situation of scurvy unless someone is protected with high dose vitamin C. Okay. Another study in the United States found almost half of the patients were vitamin C deficient, but those who didn't survive had much lower levels than those who did survive. Okay? So it's not really the coronavirus that kills people with COVID. It's usually the immune system that's overreacting against dead virus particles. Okay? And once the viral infection is over, then that triggers that well-known cytokine storm that people keep talking about. So basically an inflammatory fire that's out of control. And that's when very high doses of both steroids and vitamin C appear to be needed. So normally the adrenal glands contain 100 times more vitamin C than other organs and release both the body's most powerful steroid hormone cortisol as well as vitamin C when the body is in a state of emergency, which during cytokine storm, that's considered an emergency by the body. So the steroid helps the vitamin C get inside the cell, similar to the quercetin, the fish oil, and the black seed oil for zinc, which actually zinc disrupts viral replication. Vitamin C is getting into the cell to tone down the emergency fire immune response. Okay? So without vitamin C, the steroid hormone cortisol does not work as well. So it's mopping up the oxidant fumes of a cytokine fire inside your body. So ICU doctors now are administering both extra vitamin C and steroids to get a patient out of the danger zone. So the question is, can you prevent it? So the early intervention for first sign of infection recommended now is taking 1,000 milligrams of vitamin C per hour on the first signs of infection, and that may save even more lives. So that reduces duration and severity of symptoms, also upping your zinc to 200 milligrams a day with your quercetin or your fish oil or your black seed oil to get the zinc in the cell. Okay. Takes an average of 2 weeks of being sick with COVID-19 to trigger a cytokine storm phase. And during that time, with that uptick of the immune system, that appears to be when that immune response is creating an induced scurvy or vitamin C deficiency. So, what they think is if you can beat the infection within 48 hours, you'll be out of the woods. You can also reduce your risk further by what we've talked about, vitamin D 5,000 units a day, 20,000 international units for several days if symptoms have arrived. Magnesium as a malate, citrate, or chloride at 400 milligrams a day, and then zinc 20 milligrams a day. So the idea is to prevent. Okay? And I told you, I'd tell you a personal story, mega dosing vitamin C. This is from a guy named Alan Cohen. He's 78 years old. He has been taking 30,000 milligrams of vitamin C a day for 40 years, never gets sick. Okay? Apparently when he was a child, up until when he was about 35, he had food allergies, dairy, nuts, strawberries, chocolate. So he had difficulty going out to restaurants or whatever with friends. So he would get eczema and often asthma. So eating food, certain kinds of food, would really alter his life. So in his mid-30s, he started reading about vitamin C and started taking 1,000 milligrams twice a day. And each week he would increase that by 1,000 milligrams. So he was taking 5,000 milligrams twice a day by the 5th week. So he did that for a couple of months. A friend of his made a strawberry pie. He resisted eating that because he worried about an asthma attack because he had and severe eczema rash because he had done that from eating strawberries before. So he decided to try it since he'd been doing his vitamin C, and nothing bad occurred. He had no reaction at all, and he didn't connect it to vitamin C at first. And at that time, when he tried the pie, he was taking 10,000 milligrams per day, so 5,000 milligrams twice a day. Okay, after a couple of days, he decided to buy some fresh strawberries. He ate them with a glass of fresh whole milk. Remember, he was dairy allergic. Again, no bad occurrences. Okay, so he started really reading about vitamin C. So with that protocol, he continued that, and he's not had any food allergies since then. The problem with vitamin C is bowel tolerance. So if you take a huge amount of vitamin C, and the studies indicate, the traditional studies indicate 2,000 milligrams a day is kind of the upper limits of tolerable. Okay, so if you start taking larger doses of vitamin C, and right now the recommendation is 3,000 milligrams a day. If you get loose stools, then you back off by 500 milligrams until you can tolerate that. He talks about a woman that had ileitis, a bunch of bowel trouble, inflammation. She was in her mid-30s. She was taking sulfa antibiotics, 6 to 8 tablets a day. So sometimes, ileitis. Her skin had a tinge to it because of all the sulfa that she was taking. He says you could smell the sulfa coming through her skin. She was living on a 100% fiber-free diet. Generally, just felt sick overall every day, and was told that she would have to have most of her lower bowel removed, including having her rectum sealed and then living with a colostomy bag. So she started taking yogurt, eating fresh fruits and vegetables, and 1,000 milligrams of vitamin C twice a day, increasing by 1,000 milligrams each week. So in 5 weeks, she was taking 10,000 milligrams of vitamin C a day. So after 3 months of doing that, she reduced the sulfa antibiotics, and by the time 6 months went by, she was eating normally and taking no antibiotics. Okay, her internist was amazed because she had basically corrected her problem. Talked to the guy that recommended the vitamin C, sent a notice of that to the Journal of the American Medical Association, which they never followed up on it. So that's one of those stories that's one person, I realize. So this guy, over the course of 40 years, he's been talking to people about megadose vitamin C, friends, phone calls, whatever. So he continued to suggest that same treatment. He's saying, of course, this is not a study, this is a personal account. In all cases, it worked. They no longer suffered from some of the illnesses that they were suffering from prior to getting to 10,000 milligrams a day. Since then, he started working, when he got older, he started working as a volunteer at senior citizen rehab centers, lots of sick older people. So he increased his vitamin C to 30,000 milligrams a day. Still no diarrhea. He doesn't get sick. So basically, what he is saying is that pharmaceutical medicine does not like vitamin C. After all, this is a direct quote, after all, vitamin C works, it's not expensive, it has no side effects, so you could debate that. For him, vitamin C changed his life. So his protocol basically is taking a multivitamin once a day, additional vitamin C as described, vitamin D 5,000 international units a day. So this is his protocol. Vitamin E 400 international units a day, magnesium 400 milligrams a day, and zinc 20 milligrams a day. To find your correct dose of vitamin C, learn about bowel tolerance, the daily dose just below the amount that causes a laxative effect. So many people find that when they're not sick, a dose of 3,000 to 10,000 milligrams taken all at once will cause that laxative effect. But if they can tolerate the same amount daily if it's given in divided doses. So let's say 5,000 milligrams twice a day, or 3,000 milligrams 3 times a day. And then he says when an infection starts, much higher doses can prevent it from taking hold. He also talks about not smoking, eating healthily, don't drink alcohol to excess, etc. Before anybody does anything like that, you should check with a health coach or your physician. But that's the story on vitamin C high dose. Coming out of China, that's a double-blinded, randomized placebo-controlled study of 6,000 patients. And that's what's going on in Wuhan, the apparent center of the storm of this viral pandemic. So that's a little primer on vitamin C, and hope that gets you thinking. So have a good rest of your day. Have a good weekend. I have to grade a bunch of tests that I gave this week, and I will see you Monday at 9:30 in the morning. See you later. Bye.